It is 7:03. I'm going to call the meeting to order for the special meeting of the Lisle Township Board and ask everyone to join us in the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation,
under
God,
indivisible, with liberty
and justice for all.
That's
Hello?
Mike.
Hi, Mike.
Mike
Welcome.
Reedy here.
Thank you.
Okay.
Okay. So, Bob, I will turn it over to you for roll call, please.
Certainly, Supervisor Miller.
Here.
Senior Trustee Reedy.
Here.
Trustee Chapman.
Here, excuse me.
Trustee Allen is absent, noted by the supervisor. Trustee Signorella.
Here.
Highway Commissioner Young.
Here.
Assessor Trowbridge.
Here.
And Clerk Claren is also present.
All right.
And I just want to go through who else is there. I'm going through my screen and making sure I have it right in the order. I have David Roth. Next, I have Jordan Durrett.
Yes, sir.
Next is Christy McGovern. The next is Claire Goldenberg. The next is Lisa Rose. Next is Bill Green.
Yep.
Next is Kitty Murphy. Next is Drew Bolda. Next is my son on board, and then I have Diane Hewitt. And then Scott Silver. Did I miss anybody? I don't believe so. Thank you, Mary Jo.
Thank you. This leads to public comment on the agenda. We did have the usual form online asking for public comment, and we got no responses on the online form. With that, I'll ask if anybody on the Zoom call would like to issue any public comment. Okay, thank you. Hearing none, we'll move forward. The primary reason we convened this special meeting was really to be able to hear the results of the mental health study and the recommendations. So for everyone, David Roth is here with us and Jordan Durrett. They are with the DuPage Federation for Human Services Reform. They've been instrumental in this. Jordan has put in a ton of effort to pull this all together, and they will be talking to us tonight about the overall report, some of the recommendations that came out of it, and we'll allow them to kind of walk through it and then see if anyone on the board has any questions. And with that, I'll ask Jordan and David to take it away.
Thank you, Mary Jo. I'm Dave Roth. I'm just going to speak for about 30 seconds. I want to echo, Mary Jo, what you said about the work that Jordan has done. This is 4 months of living and breathing this information and this issue. It's about 4 or 5 months ago that we sat with you on a Zoom call and thought through this idea. We're so appreciative to Mary Jo, the township, and the trustees for your vision and support for this work. We're really hopeful that this report will be a great resource for you in your advocacy and leadership for optimal mental health. And I'm thrilled to hand it over to Jordan.
Hi, everybody. So I echo Dave. Thank you guys for giving me the opportunity to do what I love and dig into an issue. So I'm going to go ahead and share my screen and bring up the PowerPoint. Oh, Mary Jo, can you go ahead and allow me to share my screen? Oh, okay, perfect. All right, let's get into it. Okay. Okay, can everyone see this? Give me a thumbs up. Perfect, all right. So I'm a research analyst over with the DuPage Federation on Human Services Reform. And a few months ago, we started to do work on the Lisle Township mental health system. And this is kind of presenting the key findings from that study. So what we'll cover today is the purpose of the study. We'll define some key aspects. We'll look at some statistics, and then we'll kind of move into the qualitative work, the interviews, and what we gleaned from that. Then we'll go over recommendations. We'll talk a little bit about limitations. There's an acknowledgement section, and there's sources for days for this. So we won't go over that, but you could spend weeks getting lost in the sources, and this will be provided to you all. And then lastly, just my contact information at the end.
Jordan?
Yeah.
If I could ask, will you be providing this PowerPoint so I can make it part of the record?
Sure. Is that, I'm sorry, I don't know procedure correctly.
Okay, well, no, it doesn't
Later
have to
is
be.
fine.
It's just,
Yeah.
it's, if Mary Jo's okay with that, and she always is. I didn't need to ask. It's 20 pages of notes or about 5 pages of notes, try to capture the words. That's why I was just.
Got you. Yeah. Yeah, no, don't worry. This will definitely be for you guys.
Okay, thank you very much. That's why I was asking.
I understand. I take notes quite often. So, yeah, so the purpose of the study, right, is basically to understand the local Lisle Township mental health system and how it's serving your community members, your residents, right? And so the number one thing we wanted to do was identify gaps and identify strategies to address those gaps. And so when we were coming up with the research, in any research project, it's the research questions that drive any of the study that you do afterwards. So everything that I'm going to be talking about tonight, is going to come back to these 3 questions. Number 1, how does the local mental health system serve Lisle Township community members? Number 2, are there any gaps in the current local mental health system? And number 3, if there are any gaps, then how can they be addressed? And so everything will connect back to those 3 questions. Okay, so just taking a moment, I know some of this is very obvious to you all, but just to want to make sure we're all on the same page. So the geographic area of the study was obviously primarily Lisle Township, but with some of the prevalence statistics, as you'll see, I had to use zip codes, which don't necessarily fit nicely within the township boundary. So some of these zip codes are capturing areas like Western Naperville and Eastern Downers Grove, okay? And then as far as what do I mean? I keep saying Lisle Township mental health system, right? Basically, it's the system that encompasses organizations and individuals providing mental health services, individuals that want and or need mental health services. That, of course, is pretty straightforward, right? But we also wanted to include community institutions that interact with individuals with mental health concerns. And we wanted to think also about how the system impacts an individual's family, friends, loved ones, and so on. Because as we know, mental health concerns are not in isolation, they impact all of us. Okay, so this is just some basic information on your township and on some of the zip codes we use later. The reason these are broken out is because later on we'll talk about some estimations and stuff that use different age cohorts. So the pediatric, you know, those are children under the age of 18, adolescent 10 to 17 years old, adult is 18 and older. And then we look at a 15-year and younger and all of that, right? I think I'm getting a bit of feedback. Can we make sure that we're on mute? Okay. I think that's great. Thank you, guys. Okay. Yeah, and something I just wanted to mention is that Lisle Township has, give or take, about 1 in every 10 DuPage County residents that reside in your guys' borders. Okay, race and ethnicity. I wanted to show that, yes, Lisle Township is a predominantly white township, but there is a lot of diversity too. Looking at especially Latino populations and Asian populations, mixed with some Black populations as well. Asian community, Pacific Islander communities and Native American communities were below 1%, so they're not included on this chart. Okay, so now into the meat, right? The prevalence statistics. That prevalence statistics means like how many folks are going through this, whatever it is at any given time, right? And so we took a look at some quantitative data sources, such as the census, the National Study on Drug Use and Mental Health, and the Illinois Youth Survey as well, and some other sources to look at the prevalence of any mental illness, prevalence of serious mental illness, depressive symptoms and episodes, treatment rates, and then health crisis rates, people going to the ER due to mental conditions. Okay, so we'll go over these. So AMI, any mental illness, basically that just means that an adult 18 years and older who has any sort of mental, behavioral, or emotional disorder within the last year, and it was significant enough to meet the Dsm-5 criteria. And the Dsm-5 is what the psychologists and psychiatrists use to diagnose individuals with mental illness. And this is excluding developmental and substance use disorders, so that's important to note. So we used so with these estimates, they only went down to the county level, so we had to do some math to get a good estimate for the Lisle Township area. I should say that these estimates should be used with some caution, as there's some large margin of errors and things, but we do believe that this is a good approximation of how many folks are suffering with any one thing we're talking about. So between the years of 2016 and 2018, there are approximately 16,000 Lisle Township residents who were suffering from any mental illness annually. Okay. So SMI, that stands for serious mental illness. So it has all the same criteria as any mental illness, but it has an additional criteria in that those mental, behavioral, and emotional disorders must substantially interfere with one or more major life activities and or limit one or more major life activities. And that means in the workplace, at home, at social settings, there's something about the condition that is a barrier to living a full and fulfilling life. Okay. And so using the same estimates with the same caution, there was approximately 3,500 residents in Lisle Township between 2016 and 2018 annually who had a serious mental illness. Okay. Major depressive episode, right? So we're starting to get into the depression symptoms and side effects. So when we think depression, there's a lot that comes with that, but this is a very technical term. It means that somebody experienced a depressed mood or a loss of interest or pleasure in their day-to-day activities or hobbies. Things that they used to love, they've kind of lost that love for them, right? And these depressed symptoms must last for a minimum of 2 weeks continuous. And the individual must check off a bunch of the DSM-5 depression symptoms. So we're going to get some prevalence statistics on that. So let's see. So for adults, for people age 18 and older, we see that approximately, again, 3,500 individuals had Okay, I think there was a bit of an echo, but I think it's good now. Okay. The Lisle Township MDE estimate was about 3,500 annually. Okay. So and as far as, so that's adults, right? So we also wanted to look at the prevalence rates with children. So we used this survey that the Illinois Department of Human Services puts on every year and they ask 8th graders, 10th graders, and 12th graders in any county a bunch of questions, right, to see how they're doing health-wise. So the survey question here was, during the past 12 months, did you ever feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities? So that's basically getting at a major depressive episode. So over 1 in 5 8th graders, nearly 1 in 3 10th graders, and 1 in 5 12th graders all had a major depressive episode in 2018 at some point. Okay. And then, of course, one of the most serious symptoms of depression, and also a serious symptom of other major mental illnesses, is suicide. And so we wanted to know how many people had very serious thoughts of suicide. We're not talking about like those fleeting moments, you know, where you might be standing on a cliff and you're like, huh, I wonder what would happen if I jump. We're talking about people who were planning and were very serious about taking their own life. So using those estimates, about 3,250 individuals in Lisle Township, adults in Lisle Township, had serious thoughts of suicide annually between 2016 and 2018. Okay. And then for children, they didn't ask 8th graders this question, but both 10th and 12th graders, 15% of those two populations said that during the past 12 months, they felt so sad, or they had thoughts of suicide, very serious thoughts of suicide and or planning. So that's 1.5 out of 10 kids. I'm looking more at 1 in 5, closer probably.
Is that Lisle Township children, or is that DuPage County? And when was that study done?
The study was done in 2018, and it was DuPage County particularly. I do want to state that there were no drill down for primary sources of data for this. So these are estimates, and that's a very good question. And that is a caution that should be taken with all of these estimates for sure. But there is no reason to believe that Lisle Township either has a higher percentage or a lower percentage during my research. But again, take it with caution, and thank you for asking that question.
And Jordan, for the Illinois Youth Survey, one of the things we've talked about in the See Youth Coalition is that it is done every 2 years, right? And the schools themselves get their statistics, but they don't push that data out publicly, other than aggregating at a county level just to protect the individual schools and the kids.
Right, it's a privacy concern for sure. Yeah, thank you for adding that context. Context is so important with these numbers. So if you guys have questions, feel free to ask. I know I'm slinging 1,000 words at you a minute, so I hope this isn't too fast. But and so, okay, so we know now that there is folks in Lisle Township who are struggling with mental illness, right? Even so far as thoughts about taking their own lives. But we wanted to see, okay, out of those folks, how many people are seeking treatment, right? And we couldn't get an exact approximation of this just because of the way the surveys were worded. But so we did see how many folks 18 and older had received mental health services in the past year. And in DuPage County adults, and again, we're using that estimate for Lisle Township, there was about 14.67% who received treatment. And if we assume, which is a very big leap of logic, but if we assume that those 14.67% of adults all were receiving treatment and maintaining treatment and actually getting their symptoms managed, then there would still be 2.05% of Lisle Township residents who weren't receiving any sort of mental health treatment and were experiencing mental illness. And so that equates to about 2,000 Lisle Township folks who had a mental illness and were not receiving treatment. And what I want to say is, this is a big assumption to make. It's actually likely, this is a very low end estimate. It's actually very likely that people didn't stick with treatment. They didn't get the right treatment. There were barriers to continuing treatment. Also, there could be folks who went in for some mental health treatment and it turned out it was a physical condition, or that they didn't have a mental illness. So keeping that in mind, this is a very low end estimate. Okay. So now kind of looking at crisis rates, right? So once mental illness hits a crisis point, a lot of times people will go to the ER. So this is a good statistic for looking at how many people are really hitting that crisis point, right? And so these are all out of 10,000. So 43.6 out of 10,000 people. So that's just kind of how they do the rates with the ER. It's not necessarily the most logical thing, but it's a medical issue. Then they want to be very careful about privacy. But so the maps on the left that I'll be going over show kind of the density within Lisle Township, showing where there's hotspots. And then the map on the right is a comparison between DuPage County averages and Lisle Township zip codes. And so any area on the right that is shaded in means that they had a higher ER rate for whatever we're talking about than the DuPage County average was. So you're looking at hotspots relative to the surrounding communities. So as we can see, the Naperville area, areas around Lyle and Woodridge all have a bit of a heavier rate of ER visits due to an adult mental health crisis. And as we can see on the right map, Naperville is the only area in Lisle Township, and I should say this is between 2017 and 2019, that had a higher density than the county as a whole. Okay. So this is the same thing except for with pediatrics. So again, under 18, folks who had to go to the ER due to a mental health crisis, right? As we can see, it's kind of scattershot throughout the Lisle Township area, but some heavier areas. And I should say the Belmont there is just a marker that's looking more at Downers Grove area and the contributions to those statistics. Downers Grove has got a little bit of a higher area, Naperville too. But what should be noted is definitely the right map here. It's that Downers Grove, Belmont area that is higher than the county average for pediatric mental health ER rate. Now this is specifically zeroing in on adult suicide and intentional self-inflicted injury. So kind of a more specific reason than just mental illness. And as we can see, it's kind of the same areas that we're looking at. But what is really interesting and I was not necessarily expecting was on the right map, Lisle Township appears to be almost as a whole, with two exceptions, higher than the DuPage County ER rate due to adult suicide and intentional self-inflicted injury by zip code. So yeah, and that's 2017 to 2019. And then looking at adolescents, and I'll remind folks that adolescent means 10 to 17 years of age, okay? So looking at that, suicide and intentional self-inflicted injury, again, similar pattern to the adults, but luckily only one area around Downers Grove is above the county average. The rest are at or below that county average. So that's good news. Okay. So I think maybe before I get into the prevalence of co-occurring disorders, I'll go ahead and ask, just because there was a lot there for questions on the prevalence of mental health statistics. And of course, if you're still thinking it over, still digesting, there'll be time afterwards too.
Hey, Jordan.
Mhm.
I'm going to jump in for a second. Now that we're going through this together, I get to see the typos. So I want to draw our attention to the MDE number. It looks like our designer transposed the incidents from one chart into another. So the MDE number that you see in the PowerPoint is different than the one that's in your written report. And the one in the written report that you've received is accurate.
Yes. Yes, I did see that. There's just so many numbers. It's easy to
There are
get
so many.
lost.
That's right. That's right.
Okay, well then I will move into co-occurring disorders.
Real quick,
yeah.
Jordan,
Yeah,
one
sure,
thing.
sure.
There was, so there's a few questions in the chat that we can try and address later. I'd like to ask everyone to try and hold back on chat, or at least place stuff in chat now, and we may be able to get them in. If this meeting were happening in person, it wouldn't be something we could all be yelling out questions as we go. So, but if you're putting stuff in chat, that's okay. I'll try and wrap that into our discussion as later on. But there's one specific to the last couple of slides that
Sure.
was asked about how zip code is assigned. Is it where the person's treated or where the person lives?
That's a great question. Our own executive director, David Roth, asked me the same thing. And it's where they're from, not where they're treated. Yeah. Great question.
Kathy has a question also.
Hi, Jordan. I'm Kathy. If you could go back, pardon me, to the general side, I believe the graphic had around 19,000 as an indicator in the bottom corner. I'm sorry, is it the 15,000 maybe?
Here?
Yes.
Any mental illness? Yes.
Any mental illness, yes. So then that gives us kind of that overview, right, of the general. My question is of the next slide. In the series, is that a subset of the previous slide, or is that in addition to?
Subset, very good question. So anyone who is considered to have a serious mental illness also is considered to have any mental illness. It's just serious mental illness is a subset with more severe symptoms. So great question.
Yes, thank you. I just wanted to make sure I understood correctly as we were going through.
Yep.
If I could ask a question really quickly too.
Sure.
So towards the beginning, you had indicated that you had, and perhaps I misunderstood, that you had excluded the developmental issues versus social issues. Are those included in these numbers?
So oh, sorry. I'm sorry. I kept cutting you off. I get so eager to answer questions, so I apologize for that. But no, so the survey itself excluded those. That was not our choice. But when it says developmental, that means issues such as potentially autism, learning disabilities, things of that nature, because they were really wanting to look at mental illness and not developmental.
Well, I understand that, but there's quite a bit of what basically coexisting. So one brings about the other as well, and that's would actually be a part of it. I have a son with autism, so we see it, and we don't have the depression issue with my son, but we see it with other people, you know, with whom we work with these sorts of things, and you know, who we are part of groups with, that their children have it as a, you know, as another issue.
Yes, and I definitely agree with you. My mother was a special education teacher for many years. And so developmental disorders are very important to look at. I think most researchers, when they're looking at mental illness, though, and that's the reason why this national-wide survey decided to do this, is because they consider the causes and the outcomes and everything to be very different, though we know, practically speaking, that the outcomes can look very similar. So that's a very good caveat to bring up. Thank you, sir.
Okay.
Yep. Okay. Yeah, and so if we have more questions about this later, if you're sitting there stewing on things, we could definitely come back to them. But I'm going to go ahead and move on with co-occurring disorders. And so when we say co-occurring disorders in this case, we're talking about substance use disorders at the same time as having a mental illness or a mental disorder, right? And the reason why we bring this up is because a lot of work has been done about this recently. And it turns out that a lot of individuals who have substance use disorders also have mental illnesses. So in 2014, SAMHSA, I believe, ran a study and they found out that approximately 2 in 5 adults in the US with a substance use disorder also had a mental illness. And so if we, and something that's very important to note is that if we want to correctly treat co-occurring disorders, we have to treat both the substance use and the mental illness, because if you're treating one without treating the other, it's kind of like a cycle. One can re-trigger the symptoms of the other. So it's very important to stop that cycle, that we treat both. And so in our case, we're going to be looking at opiate use prevalence in Lisle Township, just because that is definitely an area of concern with the overdoses and everything. And then we'll also be looking at alcohol misuse prevalence, just due to how prevalent it is in our communities. So, okay, so when we talk about opioid misuse in this study, we decided to talk specifically about prescription pain medicine misuse. And that's not to say that there's not other types of opioid misuse happening in Lisle Township, but we do know that prescription pain medicine misuse is the most prevalent of all opioid misuse in our locality. And so what we wanted to look at is, okay, approximately how many folks in Lisle Township age 15 plus misuse prescription pain medicine. And a caveat here, the age cohorts didn't line up very well. We were using census data and the national study on drug use and mental health. And so we had to work with the age cohorts we had. So that adds a little bit extra uncertainty, but it still should be a good approximation. So approximately 2,877 people in Lisle Township, age 15 and over, had misused prescription pain medicine annually between 2016 and 2018. Okay. And so we wanted to see, okay, what's the statistics on that for children, right? So 8th graders, and what we found actually is that they're either at or slightly above that 3% statistic for everyone 15 years and older, which makes sense. So 8th graders, 3% had misused pain medicine within the last year in 2018. 4% of 10th and 12th graders had misused pain medicine within 2018. And when we say misused pain medicine, we mean they either did not have a prescription or they used it differently than prescribed. So they were taking more pills, they were taking the pills longer, all of that sort of thing. Okay. And alcohol misuse. So because alcohol use is a legal substance, obviously, I'm sure lots of us like to partake on the weekends. We really wanted to identify misuse, not just use, right? So we defined alcohol misuse as binge drinking. So that means 5 or more drinks for men on the same occasion and 4 or more drinks for women on the same occasion. Okay. So we took that information and we looked at the NSDUH survey, and we found out that over 1 in 4 residents age 12 and older were binge drinking within the past month, and that comes out to a little over 25,000 Lisle Township residents age 12 and older who had binge drank in the past month. And this is even more concerning. So The estimates here aren't even binge drinking within the last month or within the last year. They're asking 8th, 10th, and 12th graders if they've binge drank within the past 2 weeks of being asked this question. And 8th graders only 2%, 10th graders only 6%, but by senior year of high school, about 1 in 5 answered that they had been binge drinking within the past 2 weeks. Okay, so that kind of wraps up the substance use prevalence. We see that just as with mental health, there are quite a few folks within Lisle Township that are struggling with these symptoms and these concerns, right? So if we don't have any questions for that section, I'll go ahead and move into the qualitative findings. Okay, so when we talk about qualitative versus quantitative, qualitative is more about talking to people, learning about what they're doing on the ground and things like that. Quantitative is more spreadsheets and databases and numbers. But there's just things that you can't get out of a spreadsheet that you really need to do interviews or supplemental textual analysis to get and understand. So a big bulk of what we did was this qualitative finding. And so using key informant interviews and supplemental support from textual analysis of social media posts, we broke things down into 2 areas: what's working and what needs improvement. And what you'll see is there's actually crossover between what's working and what needs improvement. And that's because your guys' mental health system is a system in transition. There's a lot of good work that's already being done, and there's a lot of good work that still needs to be done. So what we found in what's working is there's been a reduction in stigma, there's been improved access to mental health treatment, and there's a growing informal referral network that helps get people to where they need to go. However, on the other hand, we did find some areas that could use improvement. Although there was more community education than ever before, there still needs to be more. There's a lack of specialty providers that we'll talk about, and the cost of mental health services can be a barrier to access. This informal referral network is good in its own way, but there might be some benefits to having a more formalized network. And then stigma is still persistent. And then last, something very timely that we're going to talk about is the concerns the pandemic has put on mental health. So we'll get into all of that. So mental health stigma, what do we mean by stigma? I'm sure most folks here know, but it just means basically a negative view of those experiencing mental health issues. It's stereotyping, right? Like, ooh, that guy's crazy, I don't want to be near him, that kind of stuff. The good news is that we're starting to see, not just in Lisle Township, but nationwide, really, a cultural shift to reducing that stigma. And what we found when we were talking to interviewees is that there is still stigma, but a lot of the service providers particularly were excited because it felt like it was the first time in a long time that opinions were beginning to change, and that stigma was being reduced. As one of our interviewees said, there's still a lot of work that needs to be done on destigmatizing mental illness, but I've been in this field for years and I'm proud of how much work has been done. So that's definitely something to celebrate. And then as far as the access improving, so there's 2 aspects to this actually. First is cost reduction practices, and we'll talk a little bit about that. And then increasing telehealth utilization, which has really been a big part of the pandemic response to mental health. One of the things that really has helped with cost reduction is mental health and substance use disorder treatment has been mandated through the Affordable Care Act and the Mental Health Parity and Addiction Act, which came a little bit before the ACA. And that opened up public insurance to folks who maybe weren't able to access private insurance, and it forced private insurers to have to treat mental illness the same way that they treat physical illness, and that they must cover it and they must provide cost supports to their clients. But yet, even with these changes in cost, a lot of the costs remain too high for some. And so a lot of service providers do things like sliding scale payments, where you pay as much as you can within reason. So let's say a service normally would cost you $100 for an hour. They will take $20 for that service and they'll write it off elsewhere. And then, of course, the free and reduced medication from this Dispensary of Hope, which is a new thing, it could be very beneficial for people who have troubles paying the very high price for some of these mental illness treatments, drug treatments. And then telehealth, it wasn't until the pandemic really that insurance providers were willing to cover telehealth. And telehealth just is seeing your doctor on the computer or your phone, or just not seeing them in person, right? And so the insurance companies during the pandemic opened up telehealth in order to help keep people safe and socially distanced. And actually, what a lot of the service providers have seen is not only more people coming in for treatment, but more people maintaining their treatment, because it's easier to go home and get on your computer and go to an appointment than it is to drive like an hour to your appointment and then drive an hour back home when you have kids to feed, soccer practice to go to, all of that, you know. Yeah. And then referral networks. So a referral network just speaks to kind of this, like the wires, the web that people in service providers use to contact each other, right? So let's say you have a client, but your services don't fit very well. You'll use your referral network, your contacts, to try and find that client a provider that has the services they need, right? And so these referral networks are exceedingly important, because if there are gaps in a referral network, clients will fall through. If there are roadblocks in that referral network, clients will stop seeking help, because it's just very frustrating. And so one of the nice things about Lisle Township providers is that they recognize the importance of the referral network, and they've spent a lot of time and energy building up an informal network through basically professional networking, events, emails, phone calls, just spending a lot of time in their days to be proactive about creating this informal referral network. Okay, so that was the good news. Now let's dig into some of the areas that can be improved, right? So almost all of the interviewees that we talked to discuss a need for more education, more community education in particular. This generation of Lisle Township residents know more about mental health than any generation before, but there's still a lot of people that have been taught myths and misconceptions that keep them from identifying symptoms in themselves and their loved ones and their friends, and keep them from seeking out treatment in a timely manner. And also keep them from seeking treatment at all because of the shame and the stigma that can come from that. And so what we do know about mental illness across the board is the sooner you get treatment for your symptoms, the better your prognosis is going to be. So those delays in seeking treatment can be, in the long run, very costly, both in a human sense and also in just dollars sense as well. So more community education could mean more people getting the treatment they need. Okay. Lack of specialty providers. Again, this is something across the board that we heard from all of our interviewees. Psychiatric services were the biggest one. There's just not enough psychiatrists. This is a nationwide shortage. So there are some issues with that. But there are areas that the township could definitely get involved in. We heard a lot from interviewees about a lack of cultural and linguistic appropriate services. So for instance, LGBTQ members especially have difficulties finding providers that are knowledgeable about the issue and don't further stigmatize people of that community. We also know that sometimes there are cultural barriers to seeking treatment. And if the treatment was more culturally aligned, more people would access it. And then as far as languages go, as one of my interviewees said, he was comfortable enough in his Spanish to have a conversation, but not to provide therapy. And yet it was difficult to get clients to service providers who felt comfortable providing care bilingually. There just weren't enough. And that's something that really does need to be addressed because there are legal implications that come from that. And so we want to make, and we also just want to make sure that our bilingual residents are taken care of. Then youth services. So in the mental health world, a lot of treatment and diagnosis is separated by age because we know that younger folks from 0 to 26, basically, their minds are still developing, right? So the way that you treat and handle mental health symptoms in a child is very different oftentimes than how you handle it in an adult. And so we need more people who specialize in those youth treatments just to make sure that our children and young adults are being adequately taken care of. And then lastly is a lack of treatment for co-occurring disorders. There are programs and facilities in DuPage County, in Lisle Township, who do treat substance use disorders, but it's very hard to get a placement in these places. There's a lot of backlogs, and people have to go way far out of their locality to just find a service that is willing to take them in. And as we mentioned before, if you don't treat the substance use aspect of the co-occurring disorder, then the mental health aspect of the disorder is just going to continue to worsen. Okay. And so we talked a bit about how there's been a lot of cost reduction practices, but unfortunately, a lot of these cost reduction practices, the money doesn't magically come out of nowhere, right? It's just those costs are passed from the client to the service provider. So providers have to offset these costs through grants, individual donations, fundraisers, etc. And so money is always really tight with these organizations. And excuse me, the more access they have to alternative sources of income, the more low-income clients and other clients in need they can serve. And then we've talked a bit about this, so I won't go into too much detail, but even though stigma has reduced, it is still present. And as a lot of people were willing to point out, any amount of stigma may prevent people from accessing mental health services. So as long as there is any amount of stigma, our work here is not done. We need to continue to do community awareness and education to combat that stigma. Okay. And I know I talked a lot about all of the resources that service providers are putting into to grow and maintain their informal referral networks. But there is a downside to that, and it's personnel turnover. The mental health field has a very high turnover rate, especially in the nonprofit world. And so when you go to connect to your buddy Ted, who you know has a program that would really help serve this client, and then it turns out that Ted has moved on to farming in Idaho, right? Then the client isn't getting services. So in order to help limit these gaps that naturally occur when you're just relying on informal referral networks, we might want to start thinking about ways that we can formalize that there's a place where service providers can go to sign up, give their details, and then to search and connect clients to other organizations. Okay. I mean, I thought this was a really important quote. Our referral network waxes and wanes. It depends on turnover, who's there as people change. Sometimes priorities change in organizations, so it's definitely one of those things that fluctuate. So what we really want to do is take that fluctuation, that variability out of the system. Okay. COVID. I know we're probably all tired of hearing that word, but COVID does have some implications for mental health, both in the short term and the long term. In the short term, we've seen a drastic increase in depression and anxiety from the general population. We've also seen, especially among young adults, 18 to 24, an increase in suicidal thoughts that is, for me personally, a little bit alarming. About 1 in 4 adults, 18 to 24-year-olds, said in June of 2020 that they had serious thoughts of suicide. And that was a very large increase from June of 2019, before the pandemic. So we know it's hitting different cohorts differently. And so there's been a large influx of people seeking services. Service providers are trying very hard to keep up with this, but the fact of the matter is that there's just not enough service providers, and there should be ways that we can help them. And long term, some experts believe that 10 to 15% of individuals who developed mental health issues during the pandemic will continue to struggle long after the pandemic is over. And that is obviously concerning. What I do want to say, and I talked about this with Mary Jo when we were looking over some of the things, is that this number doesn't have to be set in stone. It's not fate, right? There's things we can do now to help make sure that that 10 to 15% is more like 5%, more like 1%, right? Okay, and speaking of that, let's just go over some recommendations. So, so one of the biggest things that could be very beneficial in the long term is increasing community education opportunities. And the really nice thing about Lisle Township is that you guys have a bunch of local organizations that do these trainings and are eager to provide these trainings. And so partnering with these local organizations, providing them space, providing them marketing or whatever for their education opportunities could be really helpful. Because again, going back, it's been a bit now, but community education helps people identify symptoms sooner and helps them understand where they should go for treatment quicker. And so basically it's getting people into services earlier and therefore having a better prognosis long-term. And then sponsor frequent networking opportunities. So right now, it takes time to make formalized systems such as a formalized referral network. So in the meantime, while we're working on that more formal referral network, we should help continue to strengthen the informal bonds, right? So providing networking opportunities, providing advertisement for those networking opportunities will help make sure that service providers are connecting with one another and strengthening that informal referral network. And then on the flip side, while we're helping out with those gaps, we can encourage and assist local providers to enter organization details into the DuPage County's Community Resource Information System, CRIS, specifically nonprofits, but we can also look into ways that we could make a Lisle Township formal referral network. Okay. And I know this is a little corny, but seize the moment, right? There is a lot of dark cloud here, but there is a very thin silver lining to the amount of people who are for the first time experiencing mental health issues, either themselves or someone very dear to them. And so this is an opportunity where minds might be more open and receptive to education and destigmatization. That's quite a word, of mental illness, right? So seize that very thin silver lining. And then as far as COVID, so there's two parts, right? Because there's both a short term and a long term. So in the short term, reaching out to service providers in your area, asking them what sorts of additional support they may need during this time of increased need could be really helpful. And that's also setting you up long term by building these stronger relationships with service providers in your area to prepare for an elevated need, to be a little bit more proactive instead of reactive, right? So reaching out to those providers right now is a really great opportunity for both the short-term and the long-term consequences of COVID. Address lack of specialty services. So we should consider different ways that we can incentivize these specialty services. Like maybe there's a way to help train general providers in youth-specific treatments, right? Now, there's ways to help get more interpreters involved, right? So for the language aspect, we can help do workshops on cultural sensitivity for service providers and so on and so forth. And there are, as substance use disorders become more and more, it becomes more and more clear that they are a mental health issue. There are more and more service providers who are providing treatment for that. So we should look at how we can help people continue to provide those services. Now, what I should say is as far as the psychiatric shortage, that requires more study. Just because, again, as I said, it is a nationwide issue. So yeah, and then maintain telehealth successes. So right now we're not sure if insurance providers are going to continue to allow service users to use telehealth with their insurance. But we are hopeful that they will, and we could maybe work with some of the insurance companies to help remind them of how good the telehealth has been, and also find ways to support telehealth at a township level. Okay, and now limitations, right? So one thing that I want to say, and this is something that is true for a lot of data, unfortunately, is there was no readily available primary data on mental health broken out by race and ethnicity, which is important because we know that prevalence rates are likely to be different in these different communities. There was also a lack of primary data estimates for prevalence of mental illness in Lisle Township. That's why we went through the process of doing these estimations, but it would be much better if the people conducting the studies would think about smaller area sizes beyond just the county level. And then we attempted to interview a lot more mental health service users than we did. However, I did not, and this is on me, I did not take into account the effect that the pandemic is having on folks with mental health concerns. A lot of people are just trying to get by day to day and survive, even people who aren't experiencing mental illness right now. It's just hard. And so and there's also been some issues around stigma, of course. So we wanted to interview more, but we were not able to. And then, as I mentioned before, the psychiatric shortage is not, it's such a large issue that it fell outside the scope of this study. But there are likely other studies and things that we can look at specifically for the psychiatric shortage. Okay. Yeah, and acknowledgements. I know Dave gave this at the top. Sources, yes, there we go. Yeah, okay. And then that's me. So do we have any questions? I know I went through like a 39-page document here, so.
Anyone on the, any trustees, anyone on the board have any questions?
I have more of a comment. I just want to thank you for your efforts in putting this together. You know, I know it was very time consuming, but it was definitely worth it. Thank you very much for all the good information. It's very eye-opening, that's for sure. So thank you to David as well. Appreciate it very much.
Yeah, as I said at the top, I'm very appreciative of the opportunity you all allowed me to do. This is a very timely issue. It's not going anywhere. And the information I did find was very helpful. So thank you guys.
I would like to echo what Tony said, and to thank you as well. I feel much of what I'm sorry, excuse me. Much of what I took out of your report is kind of the experience many of us are having, I think, after pandemic, is that there's a lot of information that clearly when you go to look for it just doesn't exist, right? Mm-hmm. So by doing these forecastings, we can get kind of a semblance of idea or a framework for where we can move forward from. But at the end of the day, there just isn't, right? We don't have a count. It's not the same as trying to identify someone's issue in relationship to state of poverty or issue in relationship to education. This is truly an ambiguous number that we're hoping to build something around. And so I'm interested that this spoke to that idea, that we're looking for something that we know exists, but we can't get qualitative numbers. And so I thank you, Jordan, for at least trying to bring something to bring us some framework to say, hey, we know it's real. We know it's prevalent in our township. We know we're trying to find support, but no one's really collected the specific data pursuant to our township in the past. So thank you for everything. The context of this is great. I unfortunately am not going to be part of this board much longer, but this starting point of the absence of data and trying to use some national statistics or some local statistics to help us build data is very eye-opening, that this is a need for our township in the future.
Totally.
All right, Joe, I see questions coming into the chat.
I was going to jump into the chat next, so I was going to make sure no one on the board had questions. So the first question from early on in the slides, do you have a combined statistic of the, not pretty much, I think Claire, what Claire is saying is non-white to white. So instead of just each race, a combined racial statistic, is that something we could include?
Oh, sure. I would just add up the non-white numbers and then, or actually math, right? I could just subtract the white numbers from the total. That would probably be easier, right?
Yeah, so that's another way we could look at this. Another question: is mental health treatment from DuPage County Services available to Lisle Township residents? And depending on what you mean, Kitty, exactly, but like stuff like the NAMI and what the behavioral health group does in the county health department is open to all county residents. But I think the follow-up to that is what Lisa just asked. Are there any specific gaps you see with services provided by the county specifically, or long waiting lists for specific services?
That's a great question. What I will say is the county does a great job with crisis intervention. But there is a gap in that, much like every other service provider, they do have psychiatrists on staff, but they tend to prefer to not refer out those psychiatrists. So you basically have to be working with the county already to get those psychiatric services. Now there's the odd case here or there, but overall that's the truth. So that's something that they can't really help out with any more than they already do. I know that they're doing great work with the Behavioral Health Coalition to look at maybe doing a centralized ER in the county for mental health, and that could be very interesting and helpful for Lisle Township. But yeah, there's not a lot of beds for their behavioral health folks who live long term there. Yeah, I know I just rambled a lot, but I hope that answered most of it.
And I remember looking at this, looking at county health department maybe a year and a half ago, and seeing that, like, even from a funding perspective and the amount of services offered, it was very crisis focused rather than going upstream.
Yes.
And that was one of the things we talked about when NAMI kind of kicked off the Sea Youth Coalition for us at our first meeting, when the Suicide Prevention Coalition got together, and they told very specific a story that they frequently use, where somebody's falling into the river and you pull them out right before they go over the waterfall, and another person comes floating down, and those two people then reach in and pull out the person right before they go over the waterfall. And it takes somebody to finally walk upstream and stop the person from falling in the first place to actually solve the problem. And that upstream is what I think the health department is pulling people out right before they go over the edge. They're not there on walking upstream yet and being able to offer really high quality preventative care, which I think is often lacking right now.
Right, and that goes back to the education piece too, because education is such an important piece of any sort of prevention strategy. If you don't know that you're experiencing mental health symptoms, like for instance, you might write off a panic attack as just having a bad day, and then you're just having several bad days. And then, by the time you finally can't ignore these mental health symptoms anymore, you're already in crisis, right? And now you're having to look for services now while you're barely keeping it together sometimes, right? I think a lot of us have been there. You have to navigate a foreign system. So having knowledge about the system, having knowledge about mental health beforehand really helps equip residents to advocate for themselves in a way that no community organization, no governmental organization can do.
Yeah. And something else that I've heard frequently from NAMI also was in one of the graphics in the presentation of treating mental health should be the same as treating cancer, right? That it should be physical health and mental health should be treated the same way.
Yes.
And the former executive director from NAMI DuPage, I heard her say that several times in forums. And I think that is where the change happens with stigma, right? That we don't treat it as something different or something scary, that it's, hey, I broke my hand, I'm gonna go to the hospital. Should be the same thing.
Yeah.
I'm sorry.
Go ahead.
You defined an increase due to the pandemic, which is obvious and to be expected. Did I miss the number that you can attribute to that, or were we not able to attribute to that increase?
Sure. So
Quantify that increase, I apologize.
Gotcha. So let me see here.
Something like
It was over on the side. So 40.9% of respondents reported at least one adverse mental or behavioral health condition.
Right.
That was much lower. I don't have the number on hand right now, but I can
Okay.
get that for you. But it was
Very-
much lower.
It was much lower prior to that. Okay, that's what I was looking for, was what that difference was, right? I did see that number, but I thought perhaps I missed in the previous slide, up from 15% or up from, and that's, but obviously, I mean, I think, we all know people who've experienced it, whether they're, my wife's an elementary school teacher, and that's rough. But then I know that there's a lot of seniors that are in the same boat for the first time in their lives.
Yeah.
Experiencing it because they were especially shut in for a considerable amount of time.
Yeah, that's a very
And
good
of course,
point.
everybody in between. I don't mean that, but I think that's,
Yeah, when we spoke last week, when Jordan and David were briefing me on this last week, one of the things around this that I also took away is that it's not just in COVID, the increase and the potential long-term impact is the lack of identification of mental illness during isolation. That if it's hard for you to see it in yourself, right, that it's you don't have other people around you like you normally would that can identify or talk to you, intervene in some way, or you don't have those people also to lean on. That was really critical. I had a really good friend at a previous job that it took a lot of us recognizing small things and put it all together and to realize that she was approaching the break. And if we hadn't had that conversation, I don't know if she would be with us anymore. And there are people who are now isolated who aren't going to see that. Sorry.
I smile. I didn't mean to dismiss your subject. I saw your son come up the
Yeah.
other.
Same
It was
here.
a cute smile, not the depressing subject.
Got a little visitor.
Yeah.
There was a couple more questions in the chat too. I just want to make sure. Jordan, as you guys are talking about referral network, can you explain a little bit more about what you mean by referral network?
Sure. So basically, when a service provider feels like they either can't provide a service or they just don't have a service for a specific client. So for instance, maybe this private practice really specializes in anxiety treatment, right? But it turns out that the client has anxiety and depression. They'll want to refer out. So they'll want to send that client to a service provider that has the ability to treat depression. Now, obviously, this is a fake example. Most every provider who provides anxiety treatment also provides depression treatment. But so in that act of sending that client to someone else, that's a referral. And when we talk about referral networks, we're talking about kind of like a system of like all these lines that branch off, right? From one service provider to the next, so that in the end, it kind of looks like this almost web, right? So that clients who go to one provider who doesn't have what they need aren't just told, oh, I'm sorry, like I don't have that, go look somewhere else. They're directed to services that way. Because what we know is that if clients knock on enough doors and get told no, they're just going to stop knocking. Right. And then that's going to be crisis. So the referral network just speaks to those connections between service providers that they use to help get clients into the right services with the right service provider.
And then last question that's in the chat is, are there statistics of how many patients suffering mental health crises are insured versus uninsured or underinsured?
You know, I looked at that and I couldn't find anything definitive. You would think, right? But I'm sure there has to be something somewhere and I just didn't find it.
When did the Mental Health Parity Act happen?
Oh, Lord. So I know that Dave might know that one better.
Oh, I could weigh in there.
Yeah.
Parity came in with the Affordable Care Act a decade ago. But if you'd allow me an editorial comment, that was really kind of establishing a starting point from which both at the federal and state level, there's been a constant advocacy effort to enforce the reality of that. And after a decade of work, there is some really good legislation being proposed this spring in the Illinois General Assembly that could move us closer. You know, if I could editorialize a little further, there is, as Mr. DeCanto has said, the insured and the uninsured. And then there are those who are insured who really can't get that insurance company to approve payment for treatment. So it just becomes a frustration, or can't find an entity that will take that insurance. That's the fourth category I want to put, covered by Medicaid, but unable to get a psychiatrist who will accept a Medicaid payment or patient. So we've come along. That's like stigma. We've come a long way and we got a long way to go.
I was just thinking at that time, they probably did, GAO probably has a study somewhere, but I don't know if anyone would have been incentivized to continue researching that other than that advocacy.
Jordan, David, is there anything or any look as you're in these organizations, as children are beginning to go back to school? So we know one thing, a lot of reports had gone down over the last 12 months because the children aren't being seen by professionals outside of the family. Is there an expectation that over the next 3 to 6 weeks, as children return to school full time, and from what I hear, it's some classes are 90% back, some classes are 50% back, all depending upon, I don't even know how that breaks down along economic lines or within this township. Is there an anticipated growth in identification of need?
That's a really great question. I'm glad you brought that up because talking with a few of the service providers that I interviewed, this was actually something that they were already starting to see, was that they had ramped up really hard, especially youth services, like they, because they figured during the pandemic, lots of kids would need the extra help. But because they weren't seeing people at school and stuff, they weren't being identified, as you said. But now, especially after the winter break, when school started going more in person, right? They are seeing that increase currently. And the good thing is they have prepped for it, but they just don't know how deep this is going to go. And so that's something of concern that they are looking into, but they are prepared and hoping that their preparations are enough. And they are currently seeing that increase as we speak.
And I don't know about all the schools, but 202 actually did a survey with the kids, at least in junior high. I know they did, and to try and identify kids they wanted to reach out to as they started returning after winter break.
Great questions, guys.
Does anyone have other questions for Jordan and Dave?
No, but I'll throw my 2 cents in and say thank you to David and to Jordan, as well as to Mary Jo for her leadership on the issue to get us to this spot. It was a very engaging and informational presentation, and I thank you all for your services.
Thank you, sir.
I think one of the things too that we talked about last week, that the one last thing I'll mention is that one of the things I found so intriguing is around co-occurring disorders, and that the highest rate of opioid abuse, even with youth, is prescription. And I think that's a different picture than sometimes gets painted. But I think that the sensitivity to that it's not only a heroin issue, right? That there is the same misuse of prescription drugs, that that's widespread, that as a co-occurring disorder, that I thought was really kind of surprising. I think that we tend to think of it in a very single way around opioid use, and that kids, 8th graders and 10th graders and 12th graders, are accessing these same painkillers and misusing them.
Well, that's
surprising.
Unfortunately, between, and again, I know my house, again, having someone with autism, there's and there's a lot of other houses too that have different ADD medication. And again, ADD always gets blamed, and I'm not trying to do, but they have all the different medications they might have that they tried that they didn't work, but they're available. They're in a house that no one's taking, and you know, and things such as that. But I think it's the availability. Is when Jordan's shaking her head. Is that because that's where that starts? Is because of the availability? Or?
I don't have statistics on that exactly, but just my general opinion, if I can. Yeah, it's definitely an access thing. It's just much easier. I know after my dad's several back surgeries, I'm sure he still has prescription pain meds in his medicine cabinet 10 years later, you know, and we don't always keep track of it very well. So.
Yeah. And to access the other thing, the Illinois Youth Survey, one of the things that when it came out, when the 2018 version, I think, came out, Jory, I just blanked on the last name, from Prevention Leadership Team at DuPage County kind of gave the coalition an overview of it. And the alcohol misuse number, there was a second question behind that of where you got it from. And an alarmingly high amount of 8th graders and 10th graders and 12th graders were getting it from their homes, from their parents, knowing, and 8th graders, like 20% of the 8th graders drinking were getting it from their parents, openly, knowingly. And that was
Their
really,
parents knew they were taking it?
their parents were allowing them to do it.
Yeah, they break it out by did you take it or did someone give it to you? And Mary Jo is very right. I didn't include those statistics, but those are very powerful numbers.
Yeah, that was probably the most shocking as parents, especially of like 8th graders are getting it from their parents. Like everyone knows, like the house at, you know, their senior year, that the parents were like, well, if you're not going to drive, then you can drink in my house, kind of a thing. But like 8th graders, shocking. So that'll be my last little random thing I had.
I'm going to say, Mary Jo, from the board, I know everyone appreciates how you've taken the lead on this, and that I think, you know, and the board, of course, has done a great job of saying, okay, this is what we need. Let's do it, because there are options for studies, and I think they chose the most in-depth study that was presented. They wanted the most complete picture so they can move towards where the hole is, because I know everybody thinks they know where the problem is, but I think this lets us understand where it is versus just go to the loudest bugle or to the squeaky wheel, which is sometimes where people go to solve a problem because they identify it. It's that part of the problem where, you know, the person's most vocal about it, where this gives us a comprehensive view, excuse me, as to what, you know, what to try to do. I think.
And you know, I've said before, this is clearly very important to me, and an issue that I care a lot about. And I do think there are some things that we got out of this report that I had not expected, in terms of recommendations too, like something as simple as offering networking opportunities to service providers could make a huge difference in referral network and growing that, and then establishing a more formalized approach to it. You know, so I mean, we have clearly experience in networking opportunities around Jobs Club. We can translate that same approach to doing that with service providers and mental health, and help them grow their network, help establish that referral network, and, you know, leveraging what we already know how to do.
Yeah, even I didn't put this, but it's something that I've been thinking about since I finalized the study. Even reaching out to higher education in the area, and and like providing networking for those students might make them think, hey, Lisle Township is a good place to settle down and open up a practice. So there's a lot of opportunities, I think, just through reaching out to what's already there and who's coming up, that could really help.
Yeah.
David and Jordan, I just thought of another question.
Sure.
I assume you're very involved with the DuPage Department of Health, but I was wondering if you work in collaboration with Giving DuPage at all in that network of nonprofits. I would think you would, but I wanted to confirm.
Yeah, Dave.
Sure, we do. Close partnership with Shefali at Giving DuPage. So that kind of voluntary and philanthropic growth is an important part of our mission. We exist to help support a strong human service system, to build a strong system, and Giving DuPage is an essential part of that.
Yeah, and Shefali is a fantastic leader, and she's a friend too, not only to me, but to our board. So that's very good to hear. So I see opportunities to collaborate every which way. So that's all good.
Thank you guys so much for your time tonight, for going over this with us all. We don't have any specific action outlined for tonight. This is really about kind of taking it all in, being able to ask you guys questions, make sure we're understanding everything that was provided. So just wanted to make sure we had that chance to spend plenty of time with y'all.
So we appreciate that. I want to be sure to thank you for your vision for this and your guidance to us. And also to the group, I want to be sure to honor Jordan, who put this work in. This is her tremendous ability to listen to providers in the community and weave that into something that's meaningful in terms of recommendations. And then from our perspective, our mission is building strong human services. We want to be your partner for a long time. You'll have a chance to absorb this. If you have questions or follow-ups or things that we can do that would be helpful to fill in gaps, we would love to do that. We're involved in a couple of coalitions now in the community that are advancing mental health and thinking about it from an equity standpoint. We would love to connect you with health equity and access response team in the county that we're co-convening. And then we're getting human service providers together on a monthly basis to look at COVID impact and share resources. And on Thursday, we'll be looking at the American Rescue Plan, and it will have mental health resources that will be described there. And next month, our council will look at mental health impacts inside human service organizations. So any place we can connect you, we would love to do that.
Awesome. Appreciate that.
May I ask or add one more thing, Mary Jo?
Yeah.
What's interesting is kind of as we started on this path under the supervisor's direction in looking at mental health, we did hear some pushback in terms of, if this is duplication of services, or is this really our role, or, things to that effect. And one thing I would advise that might be helpful to the future narrative would be to maybe understand comparative numbers to the tangible areas we serve. And that would be like to the tangible number of people who take advantage of our food pantry. How is that reflective of the forecasted number of people in our township who might be affected by this mental health? What are the number of people who utilize our resources for rental assistance? Like, what is that number of people, and how does that compare to the numbers that you're showing us? Because I think people, again, with stigma, right, and the idea of this is tangible, people can tangibly understand if someone needs milk and cereal. And so we do a good job, I believe, as a township to help with that need to our constituents. So that's just, kind of from a user perspective, Jordan, I would say, to help people get a reference of how we're already helping and what is this population comparatively. And that might help outline for the future people who sit in the chair I'm in to identify the level of need and if this is a priority to them. So I think this is an outstanding presentation, and I can't thank you enough, Jordan, for the dive into the data and to take that dive back out and put it in a format that people can understand and now begin to question and move this forward is a huge skill and a talent. So thank you.
And to close the loop on our other services too, in terms of the pantry, in terms of our assistance, those are all intended to be stopgaps, right? And a lot of our clients also find themselves in need because they have other issues that aren't being addressed. We know for sure, some of our clientele who are homeless, face that for sure. And the population of homeless that have a mental health issue is really high. So just, we have this opportunity to not just be a stopgap, but to take that upstream approach and try and address mental health, which may then, as we move forward, for focus on mental health, especially prevention, then does the need reduce at some level, because there's clearly other things that impact the amount of people who need to come in for assistance and come into the food pantry. But are we able to address the financial cost of these stopgap measures, because we've managed to prevent some of what leads people down a bad path and put them into a place where they can't provide for themselves or can't work or can't just obtain the basic necessities of life. So I think there's a good opportunity here to kind of make a little bit of a shift in what we do to that prevention aspect. So thank you guys so much. Appreciate it.
Thank you all.
Yes, thank you for your
All
time.
of us in whatever form we continue to exist in the future, we'll, I'm sure, continue talking about this. So thank you guys.
Thank you. We'll take our leave.
Bye, y'all.
Bye. So continuing moving, the last item for tonight's discussion is discussion of potential action to set the agenda for the annual town meeting. I texted with Carrie Lynn a little bit earlier, and the executive order isn't signed yet. It's still in process. She's still confident it's going to happen, but we do still have the ability to postpone if we wish under the current law. And she sent me the extensive text of that law and around the emergency declaration, that we still have that same authority to postpone, with the idea that we would have to convene the annual meeting the third Tuesday after the emergency declaration is lifted. So that's still in effect. The executive order is just going to clarify that it continues through this year, but that order and that is still currently in effect. So we do have the ability to postpone because of the pandemic if we wish to. The concern I still have is the number of people that could show up and having space. We could do it under a tent. We could do it outside and hope the weather doesn't stink. That's kind of the risk we face, right?
Mary Jo, it seems like you would prefer to put it off, and we could put it off until, again, if we think it's going to persist, or until, let's say May, where, it would be closer to the transition, whatever that would be, into the second week or first week of May. Or we could put it, I don't think putting it off indefinitely is.
Right, and it wouldn't be indefinite. It would definitely have to be done
week.
as soon as the executive, it would have to be scheduled after the executive order or the emergency declaration is lifted around the pandemic. At minimum, it has to happen then. If the rules change and the numbers for a gathering increase, or we feel like, yay, there really will be decent weather, then
The second week in April.
Yeah, I know.
It could be beautiful, or it could be.
It could snow. I mean, I'm pretty sure Ed's had plows out around that time in the past too. So this makes it hard. Kathy, I see you have your hand raised.
Yes, I'm sorry. I'm used to kind of working in this environment. So can you clarify for me what's the choices on the table? What's our menu here? Because currently, right, the meeting is supposed to occur on what day?
April 13th.
Yeah, second Tuesday.
And so what are our choices or options as a board?
We can set the agenda tonight and schedule it and have it on the regularly scheduled day of April 13th. We can choose to postpone under the current law and emergency declaration until it is feasible to be set and not without concern for the number of people. Because I know a lot has changed this week, but I don't think they've changed the gathering size, right?
Not that I
So my experience in an election year was that we had a really big annual meeting last time. So there's a decent likelihood that we'll exceed 50. So unless we can do it outside safely, that's my big concern right now. Like I lean towards postponing just purely based on the rules in place around the pandemic.
May I clarify postponing? When you say that we can postpone and all the other, can you give me the exact parameters of what that postponement is?
So the postponement would be until the third Tuesday after 6 p.m. of the month following the expiration of the disaster declaration is how the current emergency order is written.
Okay, and if we go that route, is there an ability of a board to back that off, and then say, like, let's say
it can be scheduled anytime before that as well, if the conditions allow for it.
more, right? I would say if we get to an air time when they have moved the numbers to
Yeah, the capacity is higher.
capacity, or we found a space to move, a board has found a space to move it to, right? We do have some gathering spaces in the township. Okay, so our choice to delay it to the third Tuesday, to exercise that option is not set in stone. In the future, people could change that.
Right. That is the requirement, that once the emergency declaration is lifted, it has to happen then. It can be set for any time before that as well.
So I want to make sure I'm clear. Our choice is to establish that, yes, we are meeting on the 13th, and then adopt the agenda as you proposed. That's choice one. Choice two is to follow the recommendations of to postpone it in line with, I'm sure Carolyn gave you wording or language for us, till the third Tuesday after the executive order, or
I think we can simply postpone it in compliance with the ongoing emergency order.
Thank you.
Yeah.
Okay.
And then we don't have to set a specific time. It'll just be dependent on when the capacity limits change or the emergency declaration is lifted.
And if we exercise postponement, we do not have to set an agenda, right?
Correct. It will be set whenever because things can change in the meantime. And I think the one thing that I want to do still is the financial reports, the things that we typically report on, we'll still put out publicly. We'll still issue those. Yeah, exactly. Like
they're on our website now.
Yeah, that we'll still issue those on our website. They won't be brought up at the annual meeting, but for timing's sake, we'll still get those issued, and then just perform the actual annual meeting, since that has to be done in person. There's no allowance for it to happen in any other forum. That's kind of the sticking point.
May I also ask then that in lieu of an annual meeting as scheduled, if that's the path this board goes, might I request maybe a presentation from our service or divisions in April? Just
okay.
Yes.
Like you normally would hear from Charlie and Laura.
Yes.
Yeah,
we haven't heard from them for a while, and it's in transition of this board and potential. I think it's good for the community to hear that. So
yes,
that's
absolutely.
just a secondary agenda item request, maybe independent of that. I will defer to my other two board members if they would like to ask questions. I know how I'm leaning at this point.
Mike and Tony, any thoughts?
Well, it sounds like this discussion is leaning towards postponing just for safety concerns.
Right.
And it looks like we're going to be touching all bases anyway with, public information of what they need to know with expenditures and reports and so forth. So I would probably go that route as well.
Okay. Mike, any thoughts? Any concerns? I think I might have muted him. Let me see if.
Mike's on mute. Yeah.
Yeah. Okay. I think we're good.
Oh, there he is.
Hello.
Hey.
There you are. We hear you, Mike.
Okay, I guess I was muted or whatever, but I agree with Trustee Signorelli and Trustee Chapman.
Okay.
So if that's where we're going, I will be happy to make the motion to postpone in lieu of the situation, ongoing situation of the pandemic, to follow the guidelines till the third Tuesday as outlined by the declaration. What word am I looking for here, Mary Jo? Sorry, I don't have a script.
Emergency declaration.
By the emergency declaration. There we go.
And
I second.
Okay, great. Any other questions or discussion on postponement? Okay, with that, I'll ask Bob to take a roll call vote, please.
Certainly.
I'm sorry, Bob, before you do the roll call vote, I do have another question.
Okay.
If the governor signs some type of an order this week,
Mhm.
this motion that I've just made, that it won't affect that motion, right? We will address any issue or anything he's done at the next board meeting. We will address
Right.
then, correct?
Yes.
This motion gets us from now till that board meeting or till the third Tuesday after the post.
Yeah, and what's currently in place will continue as well. I think this is just to clarify that it's still ongoing. It's purely an executive order.
Okay.
You know, because it was kind of put in place for last year, not not dreaming that, hey, we'll have a second annual meeting that we have to postpone. So it's more of a clarification executive order from what I understand. I haven't seen the language until it gets put out, but I think that's the whole point of it.
Yes, thank you. Okay, so I'm going to maintain my order, my motion. Sorry.
Okay. All right, then I will go ahead and ask Bob to take the roll call vote.
Okay, trustee Reedy,
Yes.
trustee Chapman,
Yes.
trustee Signorella,
yes,
supervisor Mullen.
Yes. So we are set to postpone the annual meeting in line with the ongoing pandemic and executive orders that are in place. And with that, I will ask if there's a motion to adjourn.
So moved.
I move.
I'll
Second.
keep
And
it for the second.
And I'll ask Bob to take roll call on this too, unless anybody really wants to discuss it. All right, go ahead.
Trustee Reedy,
Yes.
trustee Chapman,
Yes.
trustee Signorella,
Yes.
supervisor Mullen.
Yes. Thank you all. It is 8:45. We're adjourned. Thank you for being here tonight.